This podcast is sponsored by Jabra Enhance.
How are your hearing aids sounding now?
A little tinny.
Okay, 2 seconds.
With Jabra Enhance Select's premium package, better hearing doesn't happen in a doctor's office. It happens at home, all done remotely from initial testing to adjustments.
How are they sounding now?
Fantastic.
You get the same advanced hearing aid technology and professional support you expect from a clinic at a fraction of the cost. And if you have any issues, we'll make adjustments 7 days a week, no charge.
Oh, you people are wonderful.
Our premium package includes hearing aids, 3 years of follow-up care, plus a 3-year warranty with loss and damage coverage, and a 100-day money-back guarantee.
I hear better than I ever thought possible.
And now, for a limited time, save $100 when you order Jabra Enhance Select Hearing Aids with promo code PODCAST. Go to JABRAenhance.com, enter promo code PODCAST to save. JabraEnhance.com, code PODCAST.
For eligible individuals 18 and older in 50 United States and Washington, D.C. with mild to moderate hearing loss only. Audiology team may not be able to program hearing aids for some types of hearing loss. See website for details and important safety information.
Amazon Delivery Service Partners are hiring full-time delivery drivers to meet growing customer demand. Receive compensation of at least $20 per hour at select stations, plus benefits and a sign-on bonus of $1,000 from participating DSPs if you apply now. No delivery experience required. Must be 21 years or older. Terms apply. Apply today at amazon.com/driver. That's amazon.com/driver.
Welcome to Handle with Care, Breast Cancer and Beyond, a safe place where both women and men can come and listen to real people talk about their breast cancer experience and the effects that follow well into survivorship. Hosted by Carrie Madrid, a Stage 3 breast cancer survivor and founder of the CARE Project. It's time to Handle with Care.
Hey everyone, thanks for joining me. In this episode, we are talking about balancing hormones and eliminating the side effects of menopause. So my special guest is Dr. Gail Jackson, who is out of Los Angeles, California, and she's an expert in bioidentical hormones and so much more. So kick back and enjoy. Bear with us on the audio. We needed to use Zoom, and it's a little spotty here or there, but you're going to get some great information. Make sure you leave a rating and a review, and don't forget to subscribe. Thanks for joining us today. My special guest is Dr. Gail Jackson, who's a leading specialist in holistic bioidentical hormone balancing for women, which can eliminate the effects of menopause. Is that correct?
Yeah, absolutely.
Wow. Well, welcome. I'm so glad to have you.
Thank you. Thank you.
You are a speaker, an author. I read radio and TV show host of Let's Talk Hormones. Is that correct?
That's correct.
Where is that aired?
Well, that was aired. We had a series. I probably ended it 3 years ago. For 2 years called Let's Talk Hormones. So it's on YouTube.
Oh, okay, great. So we can still look at it.
Yeah, we had guest speakers talking about with different topics, and it's posted on YouTube.
Fantastic. So I met Dr. Gail Jackson through an online networking group called the eWomen Network of Orange County, and I heard what she does and in her practice in Los Angeles. The CARE Project is based in Riverside, so we're only about an hour east of Los Angeles. So I always try to, with the breast cancer survivors that come through the CARE Project, always try to just expose them to any services that are out there. And sometimes we can help them finance them if need be. One of the things that a lot of breast cancer patients experience is being thrown into what I call early menopause. I'm sure that's probably not the technical term. So I was diagnosed at age 41 with estrogen-fed breast cancer. So I had all my treatments, and then it came time. Well, let me back up. A lot of us that endure chemo were kind of thrown into faux menopause. It just, our periods stop altogether while we're in treatment. And then at some point, it usually comes back depending on your age. And my oncologist had said to me, if you feel any cramping, you have any spotting, you think your period is coming back, call me immediately, because we need to, how do you say it when you
evaluate it?
Absolutely that. And then also just to get my hormones disabled, if you will. I mean, my ovaries, sorry, because she didn't want estrogen flowing through my body. So I opted for, my period did come back. I opted to have a total hysterectomy. I had precancerous cells on my cervix years ago. My grandmother had uterine cancer. I had been on tamoxifen for a year and a half. I did not tolerate it well. And I had read one of the side effects is it could cause uterine cancer. So I talked the OBGYN oncologist into doing the total hysterectomy, despite his warnings. You're going to be at higher risk for osteoporosis. You're still young. I was 43 at the time. He said, your vagina is going to be dry. You're going to have no sex drive. I was like, okay, but I won't have cancer down there. That's all I cared about in the moment, right? And that's what most patients care about. He even went so far as to say to me, with the best of intentions, well, uterine cancer won't kill you. And I said, well, I still don't want to hear those words ever again, right? So just take it all. So when he did, the pathology came back and I had the beginning stages of cancer on the uterine lining. So wow. I feel like I listened to my body. I listened to my spirit. I didn't have a peace about taking tamoxifen. So I went ahead and had the surgery and I'm glad. However, then came the side effects. The hot flashes, the dry vagina. If you tried to have sex, extremely painful because of the dryness and the atrophy. So can you explain for everybody, what are the side effects for this? Once you go into menopause, what do most people experience?
Well, that's a good question. When you go through menopause, what happens is your hormones are no longer being made by your ovaries in your body and your endocrine organs. And your body really then experiences the loss of hormones and it's certain conditions arise. Some of them you suggested, the dry vagina, the hot flashes, the night sweats, and those are all related to the low estrogen. And the most serious one, the long-term issue that's associated with low or no estrogen is osteoporosis and bone fractures. Elderly women tend to die from the complications of osteoporosis.
Really?
Yeah, so that's why it's important to keep your bones nice and long and strong. So if a woman is on hormone balancing, it's really important to take it a little longer, at least enough estrogen to keep your bones nice and long and strong. So when the estrogen is depleted, either surgically or by the chemo or by just aging, your body just goes into shock and just says, I need help. I need help. It screams for help.
Yeah. So, the problem that we face as survivors that had estrogen fed cancer and were younger, like I have some patients that have come through here in their 20s, 20s, early 30s. And so now we're talking them blocking estrogen at such a young age. What can you do for your bone health? What's the best thing to do?
Well, as a young person, the most important thing to do for your bone health is to consume the calcium and exercise to keep your bones nice and long and strong. So it's really not an issue with a young person because it's not as estrogen associated. It really becomes a part of the scenario for an older woman when the estrogen is depleted and the bone, and she's not as mobile, her hormones overall are depleted, then then the bones tend to be depleted and she is not mobile. So that's the issue. The bones can be thin, but when she's immobile, that just adds so much fuel to the fire.
So it's really important to just keep moving.
Yeah, but when you get older, you really cannot keep moving because you have aches, pains, and you're slow and whatever. So women in their 80s just cannot move like another woman. But when you're younger and you have that issue, you can just get in the gym, get those exercise going, make sure you have adequate vitamin D, adequate calcium, and you'll be just fine.
I think a lot of people don't realize how important vitamin D is.
Yeah.
I remember probably maybe 2 years out of like the end of active treatment, and I noticed I was just chronically exhausted for no good reason. And one day I finally stopped because I run from morning till night, and I run around crazy. And I stopped and I looked in the mirror and I looked at myself and I almost looked jaundiced. And I was like, is my cancer back? Because, cancer survivors, we go all the way left with our thoughts, right? So I'm like, oh my gosh, am I sick? Like, is my liver failing? What's happening? I had an ashy tone to my skin. And so my doctor said, oh, let's check your vitamin D. Let's check all your levels. And I was so deficient in vitamin D, I had to go on a mega dose for like 12 weeks. And I'd say after week 2, I felt 100% better.
Yeah, it's so important to balance all your hormones and the nutrients in your body, isn't it?
Yeah, it really is. So I'm shocked when you say that you can eliminate the effects of menopause. I read about the lady lift procedure. So tell me all about that.
What I'm talking about with estrogen. So, but what we can do is we have ladies who either cannot take estrogen or choose not to take estrogen, but they still insist on being absolutely fabulous for the rest of their lives. So what we offer them is a vaginal rejuvenation procedure. We, in our office, we call it the lady lift. That's our term. I thought it was the cutest term with the LYT. And then I came up with it. But if you want to Google it, just Google the O shot. So they call the O shot for over orgasm shot. So what it involves is we draw your blood and we separate off the platelet-rich plasma, so it's clear. So if you're just getting a blood test for your cholesterol, it's red when you see it in the tube. You can spin it and get rid of the red cells. Then it's clear, like lemonade. Okay, it's kind of clear and yellowish like lemonade. That is the healing, regenerative, growth factor rich part of your body and your blood. And that's how your body heals itself. If you cut yourself, that's what the body uses to heal itself. So we steal and hijack that principle in the body of the regenerative principle. And once that serum or that plasma is activated, it can be injected in any part of the body and it regenerates the cells. Some women may have heard about how, and you actually have seen a group on how people offering injections of PRP in the scalp to help with hair growth if you have little bald spots.
Oh.
So we take that amazing PRP and with a good numbing gel right here in the office, right in the next room, we can inject it underneath the urethra. It improves bladder support, your bladder support by 80%. Because with the loss of estrogen, usually women lose bladder support. And we're not talking about incontinence. Incontinence is what your auntie has in the nursing home and she wears a diaper. That's not it.
Right.
We're talking, when you peeze, when you sneeze, or you piddle when you giggle, or you you sing arias on your way to the bathroom.
Yeah.
That's what we work with. So we improved that by 80%, lasts up to 2 years. Carrie, we have a lot of product that we remove, with your blood draw. So we have more. We're like, well, while we're down there, why not use platelet-rich plasma to rejuvenate the vagina? So we pucker up the lips of the vagina. Amazing results, because as we've asked a lot of her over the years, right? Childbirth, sex, etc. Poor little lady is exhausted. So we want to, I speak for all the ladies in the world.
That's right.
She's exhausted. So the lips deflate and they droop. And so we can pucker up those lips to just make them perky and pretty. And also, on a serious note, with estrogen deficiency, oh man, the lips of the vagina just dry up and just collapse and droop. And it's just really uncomfortable to watch, as well as it's uncomfortable to try to use that vagina or have sex with that vagina. So while we're there, we can also inject good numbing gel, so not painful, not
because when you see my eyes, right, I'm like.
So we inject it in the vaginal area, the opening, and it rejuvenates that tissue around the opening. But one of the better things that you could just use for vaginal rejuvenation is this vitamin E oil from Trader Joe's. So because that feels like your normal secretions, it tastes tastes like your normal secretions, no odor. So you can put that on the vaginal area like 3 times a day. And that's that nice, those oils will be absorbed in the vagina. Oh. And that's fine. And then you can have fun with the lubricants and just use lubrication when you have sex. The thing about it is, if you continue, the problem is women have these experiences. Of course, cancer is so devastating that she may choose to stop having sex. But if she continues, the act of sex itself keeps the vagina regenerated and rejuvenated.
That's what I've heard. I've always heard that use it or lose it. Like it really applies.
It does really apply, yeah.
Well, it's good to have a doctor's backing on that. I didn't just make that up. Well, that's interesting about the vitamin E. I've never heard of that. That's good info.
I wish I had stock in it, because I sent everybody for it. And, we always have in the office, but it's amazing. So, and so what you do is you can tuck it in your bedside table because, the guys don't need to know everything. And you put it on, you'll be impressed yourself. You're like, oh my God, I feel like I was 20 or 30 down there.
I'm going straight to the store and get some vitamin E on my way home.
Yeah, just Trader Joe's is so inexpensive. Get your couple bottles. And when he comes, you're like, oh, baby, look how you keep me wet. Right. One of the many lies, that we have to, that we share. But, women can't take estrogen, but, women can take testosterone after breast issues. So, and if biochemistry, testosterone can change in small amounts to estrogen and vice versa. So we add rock to it so it stays testosterone. And the testosterone will help you keep your bones nice and long and strong, give the energy, the focus, increase the libido part of it.
Wow. I'm blown away. I had no idea. Okay,
Yeah.
So can we talk about chin hairs for a minute? This just hit me because you said testosterone and I always joke around. Like since I've had my hysterectomy, I'm like, what is all this going on my chin?
Well, that's because of it's an imbalance. So that's you're not getting the estrogen, and the testosterone is probably just over. It's a preponderance in your body. So in other words, if you could take estrogen, let's say in that world, you could take estrogen with the proper estrogen and testosterone, you wouldn't have the excessive hair. The testosterone is your main hormone, so that's why you're getting a little bit. So if the salons would just open up, I'm tired.
Seriously.
Of little extra hairs out of my brows, right?
Yeah. Yeah, seriously. Oh man.
We didn't know how much the waxing was important to us.
Yeah. And now I'm wondering, like, I've gone so long without it, like waxing my eyebrows or I call my mustache, it's kind of nice to not rely on it.
Are you married?
No.
Okay. All right. That's good. I would not go home with all of that. I'm married.
Well, no, it's not there. I found other alternatives to get rid of it myself without having to go wax it.
Oh, good. What are you using? What are you doing?
Some little tool that a friend of mine gave me. That's just like a little, what's it called? Tinkle.
It just pulls it out.
Sorry. Well, kind of shaves it off. It doesn't get rid of it entirely.
Yeah.
It's a temporary thing. So until I can get in a salon, but.
Oh yeah. You got to make it work. I have my little magnifying mirror and I'm looking in there like, okay, what's trying to okay.
Yeah, I have a set of girlfriends and we have a pact that if any of us ever become incapacitated in any way, it's like the Billy Goat hair pact, right? Like, do not let me sit there with chin hairs. You better get them out, pluck my eyebrows, and put my lip gloss on.
I made my daughter sign because I went to see my mom. I'm like, oh, poor baby. And then and also my hairstylist. I like, if you ever hear I'm in a car accident or anything, I want you there first to get
right.
You there first. Make sure the hair is hooked up. Got all the highlights.
Oh, that's funny. Hey, this is kind of random, but so I was looking at your website briefly, and I saw that it talked about Kegel exercises, right?
Uh-huh.
So let's talk about that because I saw something about men doing Kegels.
Yes.
What in the world? I never heard of that.
Well, it's basically strengthening the pelvic floor. So if you are around a man over 60-ish, he's probably going to the bathroom a lot. So once the prostate may be enlarged or inflamed a little bit, but he's going to the bathroom quite a bit. So we're teaching him how to use his Kegels, Kegels, helps him control his bladder so he won't wet, his clothes. So all of us have muscles in the pelvic floor. So the Kegels are just used to help strengthen those muscles. So when you have to go, you can just control it and hold it until you get ready to go. And so it's strengthen the Kegels.
Yeah. And, I read something else about it could possibly help with natural lubrication because you're bringing blood supply to the area.
That's really true.
I had never heard that before. Yeah. What made you get into this line of work?
Well, Carrie, I am so self-centered. And it's really all about me in the light planning way. But basically, as I started experiencing things, I wanted something that was safe for me. Okay. The bioidentical hormone balancing I wanted because I was significantly impacted with the symptoms of menopause.
Okay.
I remember I was at this party. I was 45. I was at this party. The guy was a little bit younger, and I had like a satin dress on. Hair was just done up, makeup, whatever. It was a formal Christmas dance. And I remember now just the sweat rolling down that dress under that satin that doesn't breathe.
Right.
My legs, okay? And I just went to the bathroom with a couple older women, and I'm like, what do you do about this, okay? So they told me to put my hands under the faucet and run cold water. When I got to my seat, put ice out, around it. But my evening was ruined in my experience because I did not enjoy it. I was just so hot. And I was we were in a fabulous hotel. I just wanted to get in a room and a shower and just get, cold, okay?
Yeah.
Fortunately for my patients, I was significantly impacted. So I made it my life's ambition and my life's work to find something that was safe, convenient, and effective for my ladies, because I had patients who were, I think I had that flash maybe once, but I had a handful of patients who were about 10 years older who I couldn't balance with the synthetic alternatives that were available. All we could do is keep increasing the estrogen, and it was a synthetic estrogen. They are full of the side effects, and they still were not balanced. So I knew it had to be something else there. So I decided at that time to make it my life's work to find something for them, for my friends, and for me when it was my turn. So just about everything we offer in our practice is because it's something I need, it's something I want. Said, I've got to find something out there that helps control the bladder. I said, yeah, I'd like this to be prettier, and I'd like this to be kind of perkier. So I researched, became familiar with the O-shot, and went out and was trained for it. Since I'm a urogynecological surgeon, I know the area, very well. It's just changing the product.
Yeah. When did the O-shot come about? How long's it been around?
I'm not really sure. I'd have to Google him, but he's been doing it a year. But it makes sense because what happened was it's important as a urogynecological surgeon, everything we've done to help support the bladder. We go into a little area underneath the urethra, and we take these ligaments and tighten them to support the bladder. But it's all about this area underneath the urethra supporting the bladder. So in the past, I was reading some doctors have used Juvederm to help support it, and some of the things that you put in the face to help support it, but they turned into stones, et cetera, and there was a problem. So then platelet-rich plasma came out, and people were using it for all sorts of other reasons. So a few physicians, I know they've been using it about 15 years at least. So it's not new. It's just kind of novel to some of us. But they use this product, and it's just the blood, and this is how the body heals. So it really makes, in my mind, the most sense. And so it really works. It works amazingly. I had it done myself and over 2 years ago. And it is, it's changed my life. My life doesn't evolve around the bathroom anymore.
Right. I know. And people think, people, I say me and my friends, we talked about this, I'm 49 now. But like I said, I had my hysterectomy at 43, and it was that I started feeling like I had to use the bathroom constantly. I mean, and my life revolved around where is the next bathroom? And I'd have that horrible urgency, like I had to pee so bad, and you go in there and there's like nothing.
You peed a little bit in your pants, and it's not a whole lot in your bladder, but so that's classic urgency. It's called urgency.
Yeah, it was terrible. I had the FemTouch laser procedure a few years back, and that really helped with both that as well as restoring natural lubrication. And with the natural lubrication came back the libido. So that was great, but it too lasts about 2.5 years or so before you have to have a touch up. And while I think it's a great alternative, I also like your line of thinking. If I can use something that's already in my body and natural, why would I not try that?
Yeah, that's the way I thought about it, Carrie. I was familiar with the lasers, and they're very, very expensive, and I really didn't want to the outlay of capital. And I'm like, well, why? And then they kept upgrading them, and this one's better, then this one's better, and I'm like, then I thought about myself, Carrie. It's like I was kind of joking about being self-centered, but I like, what would I want to do? What would I want to do for me? And I just cannot imagine receiving a laser for the issues that I'm dealing with. This just makes more sense to me, to be more natural. And our whole practice is sort of focused on the more natural alternatives to things. using synthetics and, and machines, et cetera, to help us.
Right. So explain in layman's terms what bioidentical hormones are.
Okay, so bioidentical hormones versus synthetic hormones. Synthetics are the ones you pick up at the retail pharmacy, the Premarin, et cetera. But there are some bioidenticals available at the retail pharmacy. But bioidentical hormones are made from the precursor of yam, okay? And synthetic hormones are made from some precursor that's made in a chemist's lab. And and synthetic hormones, this is the main important thing, synthetic hormones suppress symptoms. Okay, suppress symptoms. Bioidentical hormones are made to replicate the missing hormones. So when your body reads it, and when it's when it enters your body reads it as its own. Mm-hmm. So then it replenishes and restores that hormones or that organ in the deficit versus just suppressing your symptoms. Versus I have a headache, let me take an aspirin or Tylenol to stop the headache. Versus I have a headache, let me figure out why I have a headache.
Why I have it, right.
Fix the reason why I have a headache so I'll no longer have headaches.
Right, that's amazing. Mm-hmm. That's amazing. What other services do you provide in your practice?
Well, let's see, we'll do your annual because our ladies that come from the hormone balancing, it's no need for them to go, to go to another doctor for their annual. I stopped operating and going to the hospital. I'm on staff at Cedars-Sinai and board certified, but I stopped that bit and we sort of just focus on the all the things that keep women over 45 fabulous. So that's the bioidentical hormones, and we have the celebrity fit diet using HCG, which if anyone's interested in HCG, they stopped providing it to us as middle of March, so I stockpiled it. So once it's gone, it's gone. There is something out that's going to help be almost as good. But so we have the HCG in the Celebrity Fit Diet. That's a 1-month program. Then we have this 3-month program called the Forever Fabulous, where we add the HCG. We have a pancreas enhancer. We look at all the endocrine organs and we evaluate all the deficits and we supplement all of the deficits. The thyroid, the adrenals, the pancreas, as well as the sex hormones. So it's an all-inclusive 3-month program. The women who've been a part of that program lost 30 to 40 pounds. So that's a great one for women who want to lose that amount of weight. And then we teach you how to keep it off.
Okay, yeah, that's what I was going to say. Now, Can breast cancer survivors use HCG if their cancer was estrogen fed?
Yes, they can.
They can, okay. Mm-hmm. So it doesn't mimic estrogen or anything?
No, not at all.
Got it.
HCG is the hormone of pregnancy.
Okay. That's a misconception, I think, in the breast cancer survivor community. A lot of people hear that. They want to try it, but then we're so paranoid to do anything or eat anything or ingest anything that could replicate a hormone. So that's good information. Okay. So how can people get a hold of you?
Well, hopefully you'll post this, but my website, drgailjackson.com, and that's DRGAIL Jackson.com. drgailjackson.com. My phone number, and the best way is to email us, but our phone number is 310-451-2300. We have limited hours, and so the best way is to email us because all eyes are on the emails all the time. And it's info, INFO, at drgailjackson.com.
And you're located in the Los Angeles area?
We're West Los Angeles. We're at Olympic and Sawtelle, right off the 405. So real simple. And we're open on Saturdays, 1 Saturday a month if needed. And we have lots of ladies who fly in because the hormone balancing, oh, by the way, we offer it in the form of a pellet, which is a little kernel of cooked rice. So it lasts 4 months. So no messy, cumbersome pills and cream.
How does that work? How do those pellets work?
Well, they're size of a kernel of cooked rice. They slowly release. So I insert them. I numb up the area in your thong line. So, when you want to put on your G-string, won't be in the way. Yeah. And so I numb up the area, and then I slip it underneath the skin in that area. After numbing it up, little incision, looks like pinky nail, stick or something. Slowly releases over 4 months, results a day and a half to a week. So you just pop in every 4 months.
Wow.
So we have ladies all over California, of course, because it's easy. Everyone comes to LA, every so often. And then we have ladies that fly in. So we make ourselves available for our ladies. So if it needs to be a late evening or early morning, Right now we're in the office 2 days a week because of COVID. We just kind of compact our days and just kind of call it a.
Right. Is there hormone balancing for men?
Yes, no, because we get the women all hot and bothered. We got to hook the guys up, right? We can't
Right, because we need two
wake
people.
up.
Yeah.
Go to sleep, honey. You got to wake up because I'm ready. So
Yeah.
we offer testosterone for men in the form of pellets. And we also have the injection. Some men like the injection. And so the injection, we teach them how to self-administer that. So then we do a full exam. We have prostate supplements and to support the prostate. It's important to do an EKG on men if they're getting synthetic testosterone. So absolutely, we do manage the men. And the main thing, because a lot of women say, well, I don't want to talk to him about, the erection. So then you talk to him about energy, focus, energy, focus, and memory, etc. Always have a cute tale. So I had this first date with this guy, like the super uber successful trial lawyer, right? And so we were talking, and I started telling him about what I do and the benefits of testosterone, and he says, "Oh my God, because I used to be able to stay up until like midnight prepping for my cases, and now I'm always asleep about 9 or 10. I'd like to try that, So I drew his blood, I got imbalanced, and carried by golly, that boy married me, okay?
Woo! I love it.
And I have red bottom shoes. I said, don't buy me any more red bottom shoes, okay? So men love women who love sex. And when a woman's testosterone's balanced, that's why even in the facing with breast cancer, surviving breast cancer, we can balance you with testosterone to boost up your libido. We can do the lady lift to kind of boost it. Oh, the lady lift, we can boost up, stimulate your clitoris. We can put some of the lady lift in the PRP in your clitoris, which gets it all stimulated and hot, as well as in the vagina. So we can, we fool Mother Nature every day here, okay?
My heart is racing when you say that. I know you said numbing gel.
Yeah. But we put a little extra anesthesia. We're teeny needles. But, first of all, we have you shave. We put a full numbing gel on for 45 minutes before we do anything.
Oh, okay.
So with the clitoris, we put a little extra lidocaine there. You don't feel it. And then we put a little extra lidocaine injection in the labia, but that's after the 45-minute numbing gel.
Got it.
When you do the bladder area, you don't really feel it. You don't need anything else.
Yeah.
The labia and the bottom of the vagina, so we put a little bit of anesthesia, and then we can inject the PRP.
Got it.
It's not that painful.
Yeah. Wow.
Done, girly girl.
I'm over here like, I gotta go, Dr. Gail, to come see you.
Yes, I'll be happy to take care of you.
Fantastic. Well, thank you so much for joining me. I may have you back. After this episode airs and I get a chance to talk to my group of fellow survivors, we may have some very specific questions for you. So I hope you'll be available.
Oh, absolutely. Do a road trip. Come on up to the west side.
We'll do a field trip.
Yeah. I'll have the champagne or whatever. We'll do our little mass with champagne and just have a nice little afternoon of it.
I knew I loved you right away.
Aww.
Thank you so much.
Well, that C is for champagne, right, Carrie?
That's right. That's right.
Yeah.
All right, Dr. Jackson, thank you so much, and we will talk soon.
Okay, and thank you so much for having me. I'm really honored, and and the serious note, it's a blessing to survive and gone through what you've gone through. So we want to just really help you get back to that level of fabulousness that you had.
Thank you so much. I appreciate that.
My pleasure.
All right, you take care.
Okay, bye-bye now.
Thank you for listening to Handle with Care, Breast Cancer and Beyond. Please let us know what you think of the show by leaving a rating and review. And don't forget to share it with a friend. For more information or to connect with Carrie, go to thecareprojectinc.org.
Amazon Delivery Service Partners are hiring full-time delivery drivers to meet growing customer demand. Receive compensation of at least $20 per hour at select stations, plus benefits and a sign-on bonus of $1,000 from participating DSPs if you apply now. No delivery experience required. Must be 21 years or older. Terms apply. Apply today at Amazon.com/driver. That's Amazon.com/driver.
Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.